Good day, my name is Katrina Lorenzana Soriano and I will be showing you the basic splinting technique. The materials that you will need for basic extremity splint placement include a stockinette, cotton padding, plaster rolls or sheets, elastic bandages with clips or adhesive tape, heavy-duty scissors, and a bucket of water. Before placing a splint, carefully examine the injured extremity. Evaluate pulses, motor function, and sensory function to determine whether emergency intervention or evaluation by a specialist is necessary. Treat skin or soft tissue injuries appropriately before placing a splint. Place the patient in a comfortable position that allows you to have adequate access to all sites of the injured extremity. Remove all jewelry from the involved extremity before beginning splint placement. I will be demonstrating the application of a volar splint to an upper extremity. A volar splint can be used to immobilize a sprained wrist, a triquetral fracture or lunate dislocation, or a 2nd through 5th metacarpal head fracture. This splint should extend along the whole or aspect of the forearm from the metacarpal heads to just proximal to the radial head, allowing unencumbered flexion of the elbow. Place the forearm in a neutral position with the thumb upward and the wrist in 20 degrees extension. Apply the stockinette to the extremity, avoiding wrinkles and using sufficient length to extend 10 cm beyond each end of the splint. Cut an opening for the thumb by cutting a small hole in the stockinette where it lies across the base of the thumb, and then pull over the digit to prevent wrinkles. Use cotton padding material to pad the injured extremity for comfort and to allow for anticipated swelling. Wrap the padding around the extremity, overlapping the previous layer by 25 to 50%. Place 2 layers of padding over the entire area. In the areas of bony prominence or expected irritation, apply extra layers of padding. If substantial swelling is expected, continue wrapping for 3 to 4 layers of protection. Take care to avoid too much circumferential pressure caused by excessive stretching of the padding during the application. Select a piece of dry plaster that is slightly wider than the limb to be immobilized. In this video, I am using a 4-inch wide plaster roll that I pre-cut into sheets. Measure the length of the splint material required and then cut the dry plaster material to the appropriate length. Use at least 8 layers of plaster material for upper extremity splints and 12 layers for lower extremity splints to provide adequate strength to the completed splint. Since I am applying a volar splint, I am using 8 layers for this presentation. You may add additional layers of plaster if extra strength is required. Try to keep the total splint thickness less than 24 layers to minimize the risk of thermal injury from the plaster as it dries. Immerse the plaster material until it is saturated. Hold the wet plaster sheets vertically over the bucket and use 2 fingers to manually compress the layers in a downward motion. This removes wrinkles and excess water and will laminate the layers together. Place the plaster material over the cotton padding. Smooth the plaster to mold to the contours of the extremity in the appropriate anatomical position. Apply an additional layer of cotton padding to hold the splint in place and fold the ends of the stockinette back over the splint. Use an elastic bandage to secure the splint in place by wrapping it in a distal to proximal direction. Avoid excessive compression of the extremity when applying this elastic bandage before the plaster dries. Place the extremity in the desired anatomic position. Use the palms of your hand to mold the splint gently to the extremity, taking care to avoid creating indentations that might lead to pressure points. Allow the splint to dry without further manipulation or patient movement. Once the splint has dried completely, check for adequate immobilization, strength of splint, and patient comfort. Address any discomfort by applying additional cotton padding or by loosening the elastic bandage. Typical care after the application of this splint should include extremity elevation, application of ice packs, administration of analgesics, and appropriate communication of instructions for medical follow-up. Instruct the patient to keep the splint clean and dry and to not remove it until instructed. Give the patient verbal instructions and an easily understood written list of signs and symptoms that would necessitate urgent return for further evaluation. These include development of any signs of neurovascular compromise or compartment syndrome, such as increased swelling, worsening of pain, discoloration of the distal extremity, difficulty moving the fingers or toes, or change in sensory function. Thank you for your kind attention.